Silent night no more. Understanding sleep apnea and how to get a good night's sleep. Do you find yourself tossing and turning throughout the night, struggling to catch some Z's? You're not alone. Many people suffer from sleep disorders, with one of the most common being sleep apnea. This condition not only disrupts your sleep but can also have serious health consequences if left untreated. In this article, we'll take a closer look at what sleep apnea is, how it affects your sleep, and what you can do to finally get a good night's rest. Imagine waking up in the morning feeling refreshed and ready to take on the day ahead. It may seem like a distant dream if you're constantly battling sleep apnea. But with the right knowledge and treatment, you can finally say goodbye to those restless nights and hello to a peaceful, uninterrupted sleep. Keep reading to discover how sleep apnea can impact your overall health and well-being, and most importantly, learn how to reclaim your nights and find the restful sleep you deserve. 1. What is sleep apnea? 2. Signs and symptoms to watch out for. 3. The effects of untreated sleep apnea. 4. Treatment options for sleep apnea. 5. Tips for getting a good night's sleep. 1. What is sleep apnea? Sleep apnea is a common sleep disorder that affects millions of people worldwide. It is characterized by interruptions in breathing during sleep, which can lead to a variety of health issues. There are two main types of sleep apnea: obstructive sleep apnea, OSA, and central sleep apnea, CSA. OSA is the most common form of sleep apnea and occurs when the muscles in the back of the throat relax and block the airway during sleep. This obstruction can cause breathing to stop and start repeatedly throughout the night, leading to a poor night's sleep and other symptoms such as loud snoring, daytime fatigue, and morning headaches. CSA, on the other hand, is less common and is caused by the brain failing to send the proper signals to the muscles that control breathing during sleep. This results in irregular breathing patterns and disrupted sleep. In addition to OSA and CSA, there is also a condition known as complex sleep apnea, which is a combination of both obstructive and central sleep apnea. People of all ages and genders can experience sleep apnea, but certain factors can increase the risk of developing the disorder. These risk factors include being overweight, having a thick neck circumference, having a family history of sleep apnea, smoking, and having a narrowed airway due to allergies or sinus problems. If left untreated, sleep apnea can have serious consequences on a person's health. It has been linked to an increased risk of high blood pressure, heart disease, stroke, diabetes, and obesity. In severe cases, sleep apnea can even lead to an increased risk of heart attack and sudden death. The good news is that there are effective treatments available for sleep apnea that can help improve symptoms and overall quality of life. One common treatment is continuous positive airway pressure, CPAP, therapy, which involves wearing a mask that delivers a steady stream of air to keep the airway open during sleep. Other treatment options include oral appliances that help keep the airway open, surgery to remove excess tissue in the throat, and lifestyle changes such as losing weight and quitting smoking. In addition to seeking treatment for sleep apnea, there are also steps you can take to improve your sleep quality and reduce the risk of developing the disorder. These include maintaining a consistent sleep schedule, creating a relaxing bedtime routine, sleeping on your side instead of your back, avoiding alcohol and sedatives before bed, and keeping your bedroom dark, quiet, and cool. By understanding the causes and symptoms of sleep apnea, as well as the available treatment options, you can take control of your sleep health and finally get the good night's rest you deserve. Don't let sleep apnea keep you up at night any longer. Talk to your doctor and begin your journey towards a restful night's sleep. 2. Signs and symptoms to watch out for. Sleep apnea is a common but often overlooked sleep disorder that can have serious effects on your health if left untreated. The first step to getting help is recognizing the signs and symptoms that may be associated with the condition. One of the most common indicators of sleep apnea is chronic snoring. While snoring can be a normal occurrence for many people, especially when they are congested or tired, loud and persistent snoring can be a red flag for sleep apnea. This is because the muscles in the back of the throat relax too much during sleep, causing a partial obstruction of the airway and resulting in noisy breathing. Another symptom to watch out for is pauses in breathing during sleep. If you or a partner notice that you stop breathing for a few seconds or more while sleeping, it could be a sign of sleep apnea. This interruption in breathing can lead to interrupted sleep and decreased oxygen levels in the blood, which can have serious consequences for your overall health. Excessive daytime sleepiness is another common symptom of sleep apnea. If you find yourself feeling tired, groggy, or fatigued throughout the day despite getting what you think is a full night's sleep, it could be due to the interruptions in breathing and sleep quality caused by sleep apnea. This constant lack of restful sleep can have a negative impact on your mood, concentration, and overall quality of life. Other symptoms to watch out for include morning headaches, dry mouth or sore throat upon waking, irritability, difficulty concentrating, and high blood pressure. These symptoms can vary in severity from person to person, but if you experience one or more of them regularly, it may be a good idea to talk to your healthcare provider about the possibility of sleep apnea. It's important to remember that sleep apnea can affect anyone, regardless of age, gender, or weight. While certain factors such as obesity, smoking, and a family history of sleep apnea can increase your risk, the condition can develop in anyone. If you suspect that you may have sleep apnea based on these signs and symptoms, it's crucial to seek medical attention for a proper diagnosis and treatment plan. A healthcare provider can conduct a sleep study to monitor your breathing patterns and other physiological factors while you sleep, which can provide valuable information about the severity of your condition. By paying attention to the warning signs of sleep apnea and seeking help when needed, you can take the first step towards improving your sleep quality and overall health. Don't ignore the signs. A good night's sleep is within reach. 3. The effects of untreated sleep apnea. Untreated sleep apnea can have some serious effects on your health and well-being. One of the most immediate consequences is the impact on your sleep quality. People with sleep apnea often experience frequent interruptions in their sleep due to periods of shallow breathing or pauses in breathing during the night. These interruptions can prevent you from reaching the deeper stages of sleep that are crucial for feeling rested and rejuvenated. The lack of quality sleep can lead to a range of daytime symptoms that can affect your daily life. You may find yourself feeling excessively tired during the day, even after a full night's sleep. This can make it difficult to concentrate, focus, and stay alert throughout the day. It can also lead to mood swings, irritability, and even depression. Untreated sleep apnea has also been linked to an increased risk of accidents, both at work and on the road, due to impaired cognitive function and decreased vigilance. In addition to the immediate effects on your sleep quality and daytime functioning, untreated sleep apnea can have long-term consequences for your overall health. Over time, the repeated interruptions in breathing can put a strain on your cardiovascular system, leading to an increased risk of high blood pressure, heart disease, and stroke. Sleep apnea has also been linked to an increased risk of type 2 diabetes, obesity, and other chronic health conditions. Furthermore, untreated sleep apnea can have a negative impact on your relationships and quality of life. The symptoms of sleep apnea, such as loud snoring and gasping for air during the night, can disrupt your partner's sleep as well. This can lead to resentment, strain, and communication problems in your relationship. The daytime symptoms of sleep apnea can also affect your ability to participate in social activities, exercise, and enjoy hobbies, leading to a decreased quality of life overall. It's important to recognize the effects of untreated sleep apnea and take steps to address the issue. If you suspect that you may have sleep apnea, it's essential to consult with a healthcare professional for a proper evaluation and diagnosis. Treatment options for sleep apnea may include lifestyle changes, such as weight loss or quitting smoking, as well as continuous positive airway pressure, CPAP, therapy or oral appliances to help keep your airway open during sleep. By addressing your sleep apnea and improving your sleep quality, you can not only reduce the immediate symptoms of the condition but also lower your risk of developing long-term health issues. Getting a good night's sleep is essential for your overall well-being, and taking steps to address sleep apnea is a crucial step in ensuring that you can enjoy restful and rejuvenating sleep for years to come.